To demonstrate the VentLab airflow manual resuscitator, or ventilator as some folks call them, manual ventilators. This is the adult size. So when you pull it out of the package, you'll want to expand it. It comes collapsed on the adult size. 7-foot standard tubing with this. Has a red fits-all connector on the end, so it's kind of a universal connector. So if you're missing your small bore tubing connector, or Christmas tree, as some folks like to refer to them as, if this is missing off your flow meter, you can still connect this the oxygen connector to the flow meter on the male connection. So you can do it whether this is on there or not. All right, so you don't have to hunt for a Christmas tree. All right, so 7-foot standard tubing. We have different configurations for our reservoirs. This is a bag reservoir. We have corrugated tubing reservoir if a hospital prefers it. So we can do different reservoirs. The bag reservoir will provide the highest FiO2 to the patient, but if for some reason somebody wants a corrugated tubing, we can do that. Slightly lower FiO2. All right. So tailpiece, bag body. The airflow manual ventilator has of course, a clear, kind of transparent body. It's more of a vinyl type material, very easy to grip, right? So if you have a gloved hand on, of course, which you will most of the time, you can grip this fairly easy. All right. So transparent, so you can see. You also have a swivel, so the patient valve will swivel separately from the bag, but also we have a patient swivel, patient connection port swivel for this bag also. The bag comes standard with a premium mask that has a valve on it to inflate, or if you want to partially deflate it, you can do that, but you can put as much air as you want to. So this is our premium mask. It also has the blow molded mask, which is missing the valve. So if a hospital would prefer to use the blow molded mask, we also have that option too. All right. Airflow resuscitator, manual ventilator, comes standard with a integrated manometer. VentLab has the patent for that, so we're the only one that can actually build the manometer into the bag, into the patient valve. All right. So as you can see, the manometer is color coded. It's green from 0 to 20. It's yellow coloring from 20 to 40, and of course the red coloring from 40 and above. All right. So integrated manometer. Very important to have a manometer, whether using a pediatric or infant bag. We put these on our adult bags also, and there's different reasons to use a manometer, certainly, but you know, one of the biggest reasons is to prevent gastric insufflation when you're mass bagging your patient before they're intubated. Keeping the manometer in the green will prevent that from happening. It takes about 20 centimeters to override the esophageal sphincter. Once you do that, you start pushing air into the stomach and less into the lungs. All right. The other thing, since this is a manual ventilator, you know, if I need to do PEEP, I would place the PEEP valve on the resuscitation bag. All right, so I can provide PEEP. I have a manometer. The other thing we do with the airflow bag is, you know, it's a manual ventilator. It comes standard with the bacterial viral filter that fits on the exhalation port. And as I showed you on the PEEP, the PEEP valve can actually go on the filter. If the filter is missing, it can still go on the bag on the exhalation port. Okay, so it will fit either way. All right. So bacterial viral filter, very important. You know, the manometer protects the patient. You know, you can limit pressure and do those things, but the filter protects the staff, protects other patients, and it protects visitors from what the patient may have. So that's the run through with the airflow manual ventilator. This is our adult size. I do want to show you an additional feature that we can do. We can do a pop-off, which is an extra safety feature. We can do it on any of our bags. We can do it on the adult bag also. If a customer chooses to do that, a hospital wants that on that bag, we can certainly do that. It does come standard on our infant and small child bag, so it does come standard on both of those. So it's actually a 40 centimeter pop-off. It is active when it comes out of the package, and that's the other thing I didn't mention. When these bags, once you unfold them, the filter and everything's already pre-attached. The pop-off's already active and ready to go. So it's a 40 centimeter pop-off. You should be able to see that writing on it. It should say active. You know, it says active, it says 40 centimeters. I should be able to see that. That way I know it's active. So it will pop off at 40 centimeters of pressure. If for some reason you need more pressure and you need to override that pop off, you would have to cap it, okay? So otherwise it should stay uncapped and dangling out like this, all right, so that it's an active pop off, all right? So that's a feature that comes standards on the two, like I said, the infant bag and child bag, but it's an option that we can do on the other bags also. We do have a 25 centimeter pop off. If on the infant bag, if the facility wants a pop off that's a little smaller, a little lower pressure, so to speak, that would be the 25 centimeter pop off. The only difference is it acts in the same way. It's positioned in the same place, but it has, of course, it's going to pop off at 25 versus 40, but it'll actually have red writing and say active. So the print on it is actually red versus black, and it'll say 25 centimeters on it. So that's really the difference. All right, so that kind of concludes the demonstration of the airflow manual ventilator.